name is Amany Tawfik, and I'm an associate professor at Augusta University, oral biology and cell biology and anatomy departments. I'm studying the nutritional deficiencies and their impact on vision, particularly vitamin B12 and folic acid deficiency.
What did you present at ARVO 2019?
Actually, I'm presenting the impact of vitamin deficiency gonna lead to increased amino acid called homocysteine, and when this amino acid is increased in the body, it leads to problems in the vasculature of the eye. So my work presented this year is how homocysteine induce inflammation as a mechanism leading to age-related macular degeneration and possible also diabetic retinopathy.
What were your findings?
Many of eye disease which really lead to loss of vision, like diabetic retinopathy and age-related macular degeneration, and actually they are expected to increase over the time, that we can do we can do prevention and we can do early diagnosis if we look for the level of homocysteine as prognostic and diagnostic, and also a therapeutic target in those diseases. We find that homocysteine is bad for the vasculature of the eye, and it leads to leakage. It leads to all the processes which could progress the incidence of diabetic retinopathy and age-related macular degeneration. So my suggestion, we can first of all eat well, good nutrition. Second, if we don't have this good nutrition, so we can measure the level of homocysteine and we can actually help increase or the progression disease or can prevent the disease.
What do you suggest nutritionally?
Not by nutrition I recommended. I actually going with the trend of eating healthy food gonna help your vision. And it's not only me, there was a big study, actually it was adopted by NIH to study the impact of using antioxidant and healthy food on vision, and actually they found, and omega-3 and others, they found actually they decreased the incidence of age-related macular degeneration by 25%. But unfortunately, homocysteine or vitamin B12 folic acid were not evaluated. I'm highlighting actually or adding those good nutrition to what has been studied before, that homocysteine should be measured in aging patient and patient who have diabetes. And if the level of homocysteine is high, we could actually either decrease the level and also make more follow-up for those patients, because they are more prone or more liable to have or to progress into disease stage.
What are your next steps?
Our next step, we are actually looking for the mechanisms. How is homocysteine inducing vascular leakage and impact the blood-retinal barrier, either in diabetic retinopathy and aging, age-related macular degeneration. So we are looking for the mechanism underlying the pathology happening in increased level of homocysteine, which is known as hyperhomocysteinemia. And we found that oxidative stress play a role, genetic modification play a role, epigenetic modifications. We found inflammation, this is our work today, and there is also activation in methyl aspartate receptor. So we are looking for the underlying process so we can find a therapeutic target to help in treating those diseases, especially once the disease process started. Either diabetic retinopathy or age-related macular degeneration cannot be prevented, but we try to slow down and make less complication.
Based on your research findings, what are your recommendations for patients?
It's early in this stage, but my recommendation that if you are diabetic and or after above the age of 50. When you visit your physician, primary care doctor, ask about the amino acid homocysteine, ask about the level of vitamin B12, if it is good or not in your blood. If not, need to be taken, and the level of homocysteine, if it is high, so the doctor knows how to take the measure in this situation. So at least we highlight an amino acid which is, when it is increased above the normal level, it is harmful to the body. Actually, homocysteine is well known as a risk factor for cardiovascular disease. It's well known. It's measured in a patient with vascular problem. So the eye is actually has a lot of vasculature, and diabetic retinopathy, age-related macular degeneration are disease which the vasculature are involved with a lot. So making sure that the level of homocysteine was at the normal level and could be prevented with a simple, there is many causes of increased homocysteine, but one of them actually is simple, eating healthy food. Vitamin B12 is, it is in the protein food like salmon and the good protein, and folic acid, it is in the very green vegetables, so it's easy to prevent disease if we eat healthy.